was persistent and love bombed her and just was there.
Have boundaries and listen to their gut and their intuition like you're.
Welcome to the Heal, Thrive, Dream podcast, where trauma survivors become healthy thrivers. Each month will feature a theme in the trauma recovery and empowerment field. To promote your recovery, healing, and learning how to build dreams, here's your host, Karen Robinson, transformational coach and therapist.
Hi there. Welcome back to the Heal, Thrive, Dream podcast. Today, our guest is Dr. Leslie Dobson. She is a clinical and forensic psychologist. She has worked with some of the most dangerous people in our country and now works in private practice treating victims of trauma perpetuated by the criminals she once walked the halls with. Dr. Leslie has endured trauma, studied trauma, and strives to treat trauma in her clients, both in litigation and in therapy. So that's quite the bio, Dr. Dobson. Is there anything you'd like to add to that?
Hi, thank you for having me. That's quite the bio. I can be a heavy person to talk to, but I can also be a very lighthearted person to talk to. In addition to all of my work, I have two kids. And I love watching the Housewives on Bravo. So the pendulum swings both ways with the heaviness and where my heart goes.
I'm glad that you're living I know balance doesn't truly exist, but we all try to attempt that. So a common question I ask folks, and you can always decline to answer or share what's comfortable, is a lot of providers who do the work with survivors are often survivors themselves, and you mentioned that you were. What about your personal story are you comfortable with sharing today?
I'm a very open book, and I really believe that I need to be an open book to gain that trust with my clients, because if I'm hearing about their lives, they need to know if there's something in me that plays into that. Right? Both show up in the room. I didn't have the greatest childhood. I don't had a lot of attention. There were a lot of challenges in my family. We moved a lot. I'm a kid of divorced parents. But I think, that was partly motivated for me to get into the field of psychology. But I would say I endured the most trauma working with actual criminal and patients because of the violence that was around me multiple times, all day, every day. Feeling very, very stuck. Literally, I was stuck in these prisons with them. You don't get to leave when you want to. But also feeling very stuck in my career because I had massive student loans and I wanted to work for public service for my loans to be forgiven. And so it was a dark time when I was seeing violence every day and I didn't feel like there was any way I could get out of it.
That's an interesting thing that you mentioned about being trapped because of the student loans. It's interesting how many of us find ourselves trapped in that. I worked for the Department of Defense, and it wasn't just I had a few criminals, but not to the magnitude you did. But it was still a very oppressive system to work within. And I often felt trapped there until one day I was like, I'm not sure the student loan forgiveness program is worth it. That's how I felt on some days. So did you make it the 10 years in the prison system before leaving, or did you have to leave before then?
I left. I moved into the VA system for a while, working with veterans, and I was pregnant at the time, my own sanity. But it took me 5 years to get that job, so I really couldn't get out of the criminal life. And no, I made 9 years. I have one more year, and I don't feel bad about it because I'm starting a non, and that's what's going to count for that final year for free mental health services for people. But I mean, I have a little bit of jealousy. I did watch my husband a few months ago who's have all his loans forgiven. I might have frozen. Are you still there?
Oh, can you still hear me? Yep, you froze up again.
I
Oh, you're
I
back.
think I can't hear you. I think I said
Okay,
should I
so you had a
repeat
little.
it?
I think what we heard you say is that there is some jealousy when your husband had his loans forgiven. Yeah, I experienced that myself too. So I not with my husband, but just friends and stuff. So I'm almost there. Well, I think I just got to do one more piece of paper and I should be good to go. I worked for the DoD for 17 years, but I'm not sure how I did it. I really don't.
That's
Um,
amazing.
yeah,
That's amazing.
yeah, it was pretty tough. Okay, so what are you comfortable with sharing with the things that you had to hear? Like, I don't want to re-traumatize anybody in our audience. Like, what could you say about that work so people understood the magnitude without getting into specifics? Maybe.
Um, so in the forensic world, the clients were being charged with violent felonies, or they had already served their time and weren't safe to go back to the community. So they were in the hospital with me. And the parts of that were the most difficult were, at least in California, they were considered patients rather than inmates. So they didn't have the same regulations around their movement. They weren't in jail cells like you would see in a movie. I was just walking the halls with them. Uh, so there were 2,000 staff members at one facility I worked at, and 1,200 inmates or patients. And it was scary in the sense that you just never knew when and you had to live with this high level of vigilance and awareness, almost like in armor, like you were a police officer. Uh, and it was very difficult to live at that heightened sensitivity all day, every day. And when I realized was when I had my first daughter and I had to take uniform off in order to be vulnerable and present with her. And I started to see that differentiation and how exhausting that was and how I didn't want to do that. I wanted to work and be a mom and be the same person for both.
Yeah. 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 What you described was sort of like I work with a lot of combat vets too. It's like you to be you're hyper vigilant, which causes hyper arousal in theater or in combat, and then you're supposed to come home and be a different person to be someone nurturing and loving to your family. That's a hard dichotomy to keep up with. So yeah, I'm glad that you decided to go for you and your daughter. Yeah. So how did you proceed with your healing journey after that kind of traumatic experience?
I had I had other traumas I endured. Like I did fertility treatment for 8 years and miscarriages, and then when my son was born, he's 2 now, he almost died during the C-section. And so there were these, which I think a lot of people experience, is that we don't just heal, right? We have to deal with life and keep trying to heal as we accrue more trauma. So it was a slow moving transition for me. And now I'm 40 years old and I started private practice, like I really got into it about 3 years ago. And I said to myself, I am going to be empowered. I am not going to ask for forgiveness. I'm going to go with my gut and intuition with what I want to do with work and parenting and friendships and relationships. And when I gave myself that permission, I feel like that's when I really started to heal. I started to counteract that vulnerable feeling of being a victim. And I found that empowerment of being a survivor. And I brought that into my private practice. And now the most beautiful moments I have are when I can lift up other women and get them to that platform with me.
That is really beautiful. I love that. Yeah. So it sounds like just tapping into that inner wisdom that we all have. We had another podcast morning with a survivor who mentioned that when she met her husband, her ex-husband, that those flags and warning bells went off right away. But because she was so starved for affection, because she didn't get it at all in her childhood from her family, she wasn't wanted, she wasn't loved, she wasn't cherished, valued, that whole thing, and abused her whole childhood. So when this person was persistent and loved bombed her and just was there, she still chose to be in relationship with him and married him. She totally ignored the intuition that she had. And, she's not beating herself up because she understands like the pattern that happens and how we all can get, any of us that's desperate for love and attention, we're going to make mistakes like that. So anyway, I'm glad that to hear you're working on that with your clients, because I think that is the number one thing we can give them other than sit with them and be present for their stories. Yeah. So what else do you do with your clients that's empowering?
So when COVID hit, I started writing a book because what I noticed with my clients was that some people really disliked COVID because of the isolation, of course, with everything else. Uh, but just looking at the relational aspect, some people really didn't like that. But some people loved it. Some people loved being able to others and have boundaries and listen to their gut and their intuition, like your other podcaster. And so I started writing about this because I found it so interesting. Why aren't we listening to our gut? Why do we need COVID to say, wait, these aren't healthy relationships. These are toxic people. Stay away from them. So this book, it's coming out, I think at the end of the year, hopefully. But it talks about giving yourself permission to stand up for you and identifying the people around you for what they really are. Are they good? Do they give you energy? Are they, energy vampires? And setting those boundaries based on knowing who you are, your gut, your intuition, the red flags you see, and definitely your attachment style. And putting that all together to just empower you. That's what I really like to do with my clients. And then I still do forensic work too, which I feel very confident doing because I've gotten to this place of feeling like I know who I am.
Yeah. Knowing who we are is certainly helpful for boundary setting and all that goes in there. Now, I had a question that was on the tip of my tongue, and now I'm forgetting it. And I really hate what happens when it's live. Hmm. Oh, yeah, your book. That's what I want to ask about. So I know, like, by the time this is published, your book will be on the market. So are you comfortable with sharing the title? Like, I'll put the information in the show notes when it's published.
Sure. Right now it's going to be called The Friend Cleanse.
The Friend Lens?
The Friend Cleanse.
Oh, the Friend Cleanse.
Yeah.
Okay. So, and you're crediting this idea, is that right? Like that because we got quieter?
I,
Is that
relational, the relational piece of COVID was really inspiring to me because of how I saw my clients all manage it differently and how some really were doing a lot better because of the forced boundaries.
yes. Yeah. And then some who were living with unhealthy people did a whole lot worse. Yeah.
Yes. Yes. It became, I think COVID for a lot of people that, the 3, 4 years became, they magnified everything. But if we can take positivity out of the says, they magnified who we are, what we want, what we need. We are better able to identify it now because so much.
That's a really good point. Okay. So tell us about the nonprofit you're going to start. Is it about survivors or something else?
Yeah, ideally it's going to be a donation-based nonprofit like all are, but the money would go to paying mental health providers or any wellness provider that's needed, right? It could be a chiropractor. It could be a plumber who can come out and help you fix your home because you can't afford it, and that's leading to your mental health declining. So the premise is that all this money will go to people in need in any way to make them well. And a lot of those people will have mental health needs. Because the wait list I have right now is largely a need for therapy, different types of therapy. Maybe it's ER, eye movement, desensitization, talk therapy, psychiatric care, different kind of, we have a lot of neurological treatments right now for trauma. So they're very expensive. They're not often covered by insurance, or a lot of providers are not on insurance because insurance is such a struggle the donations will help people who can't get help.
And is your nonprofit live at this point?
The website's not live, and we haven't fully decided what to name it.
Just gonna ask you that.
So far, I think we're gonna go with Wellness Warriors.
Okay.
But it is the Dobson Cook Foundation. My husband, his last name is Cook. So it will always be the Dobson Cook Foundation, but I want the website to be very interactive. I'll be mentioning it on my website. My website's Dr. Leslie Dobson, and it will talk about the nonprofit, how to link, how to donate. And then it'll have the book on there with this really cool interactive app where you can literally move your friends around on a sphere around you and feel like you can really control the relationship.
Because I have taken a closer look of my friendships too over time. There's definitely people that suck energy and other people that let you up. And I think we have this false belief if someone's been a friend for many, many, many years that we should keep them. And I think it's okay to challenge those beliefs that we have around that. So that sounds really kind of cool, that feature. Yeah.
Yeah.
And when did what gave you the idea to launch this nonprofit? How does that, I love hearing about how people dream about things and how they come into existence. I think that's huge for survivors to believe in themselves and believe that they can have dreams, make things happen. So is this a nonprofit that you have a dream about? You burning desire to make a bigger difference in the world? Tell me more about your process.
It really started when I started working in civil law. So I take on cases. I'm an expert in a case where I evaluate the truthfulness of someone's claims. And it can be the plaintiff who is suing someone for something that made trauma in them, or it can be the defendant who's saying, I didn't do it. I do these psychological testing assessments, and I help explain to the court who's telling the truth. And in doing this, a lot of the victims or survivors, whatever they identify with, they don't win. And that is a lot of the legal system in America, the games that lawyers play. But at the end of the day, they don't win, and they don't have money to help themselves. So in the case, we figure out exactly what they need. I can diagnose them. I can tell them what treatments they need. But then if you don't win the case and you don't have any money, you can't get the treatments. So that's what inspired the nonprofit was can we take from people who are very wealthy? Can they donate just a bit and help these victims, these survivors access care when they are the ones who are really struggling, especially after being in litigation? I mean, your average personal injury lawsuit can go on from 2 to 4 years. So you're reliving the trauma constantly and with lawyers who aren't that empathic. So I find that, even if they win a case, victims of trauma feel worse after the legal battle. And that's what really inspired me, is to make sure I can offer them something at the end.
This is so powerful because a lot of times you would think a survivor would feel more empowered if winning, but it's such a brutal process. How do you help people make sense that when they tell their truth, they still may not win a lawsuit? Do you have words for that?
Oh yeah. All of my clients, once I form an objective opinion, I explain it to them. If I believe a client is telling the truth, then we start talking about the legal process. And I help advocate them to understand what lawyers do, to understand a trial, to understand what goes into it. And so much of trial and law is strategy and games and the perception that a jury has and what they link onto, as well as prior case law. So if we can understand what's going on and realize that our truth isn't the biggest factor, it's very validating.
Yeah. It really is worse than a slap in the face to the court, to the jury, and then you don't win, because who's really winning, right? Win the case. It is still hard to see the point in the court system at times. Yeah.
Yes. And it's so much of it is a song and dance by the attorneys. And, we have to understand that it doesn't take away from our truth, and that we just need to find another way to use our meaning and our truth and get our treatment. And that may be other people starting their own nonprofits, right? But finding purpose in your life after pain is the key takeaway.
But before we get into purpose and hope and all that, because that's definitely where I'd like us to go, how do you keep showing up for court? Like, what keeps you going, knowing that the person you're advocating for may lose their case? Because I would think that would kind of suck after a while. If you keep, I know sometimes it happens that we win, but when your survivor consistently doesn't, like, how do you keep going on that? Like, how do you take care of yourself during that process?
I make sure I have a mastery over my testing data and the evaluations and the interviews, and I go above and beyond. I research, I read evidence-based articles, in any relation, and that relate in any way to the case and what's going on, to the testing measures, to where we are in the legal world right now. And so I know that I am presenting to the best of my ability an explanation of the truth. And 5% of this overall case, because there are so many experts, there are so many witnesses, the lawyers have so much fun and control over their cross-examination. But all I can do is know that I feel true and I feel confident that I've done everything I can to portray the truth that I'm seeing.
Awesome. So what I'm hearing you say is that the only thing you can control is how that you do in your work. So just being prepared as best as you can and doing your best. At the end of the day, that's all that you can really do. You can't control the outcome. So I think that's a good takeaway for sure. And I'm glad you have given up on doing the work, because if everybody gave up who did hard work, where would we be, right? It wouldn't be helping the system at all. Okay, so what else? What is your best suggestions or tips for survivors listening today and they are trying to decide whether or not to press charges against their offender or abuser? Like, how do you help people make that kind of decision, knowing it's going to be tough?
Right. Um, I like to encourage people to think about what they want out of it. Is the process, is the journey what you want? A lot of people want money, but a lot of people want justice and closure. And is this going to hurt you more, or is it going to help you? Is the re-traumatization of telling your story over and over to lawyers and being attacked by lawyers and them trying to make you look like you have no credit, pulling up your entire life history, your social media history, interviewing everyone you've ever known, because it can get to that degree. Is it worth it to you to get to your goal? And if it's not, then how can you find your goal? How can you find your closure without engaging in a legal process? Can you be happy? Can you move beyond the trauma in a different way and not re-traumatize and injure yourself through the process? And those are two different people. And it's also okay to start a legal process and then stop because it's too much.
Yeah, I agree. Yeah, so it sounds like you're not married to people going to court. You're married to people making the best decisions for themselves and their health and mental health. Yeah.
Very much. I'm hired by the legal team. I'm not hired by the client. And so my information is for the court. I don't have one side or another. I go into it very open, just wanting to find the truth. But in doing so, I see the pain and I see how it plays out and how difficult it is for people to constantly bring up their trauma and go through this process. I'm a psychologist, right? Everything I want is just health and wellness. And I look at struggle and I say, okay, how can we get around this? How can we make life better? Sometimes it's a legal case. Sometimes it's doing something else with your time.
Mm-hmm. Yeah. And do you work with some survivors who go on to when they start their healing journey, that they do something to give back or to make a difference to other survivors? Do you see that very much?
Yeah, no, I think there's a process of shock after all of the legal struggles. But then I think once we ground ourselves, people get back to feeling a meaningful purpose in their life and wanted to do the litigation. They felt that they needed to, and regardless of the outcome, there's a life you have to look after. And a lot of people will give back. A lot of people have gone back to school to be therapists, or they'll become sponsors in AA or NA, or they'll start to work with NAMI, the National Alliance for Mental Illness. But giving back and educating people on what they just went through is very powerful and gives their life purpose and meaning and control.
Beautiful. So I'm guessing that your private practice, you see clients in California. Is that right? You do. Go ahead.
Yeah, I'm in Los Angeles County in California.
Okay. Do you do virtual or just in person at this point, or a mixture?
A mixture, definitely. I prefer in person because I just think it's more effective and more real. But I see people all over the state, and it's you can't travel 4 hours for therapy. So
Great, great. You licensed in any other states?
no, I'm not. I consult with attorneys throughout the country, and I have speaking engagements, and I go out and work in other states. But with my therapy license, I can only do therapy for a California resident.
Okay. Have you thought about doing some coaching so you could help women in other states, or not? Are you feeling like that's the spot, I think?
Oh no, it's um
Yeah.
I have this goal and I have this vision, but I haven't put it to fruition yet. I want to start a retreat. I want to start a female empowerment retreat. And there are so many out there, and a lot of them life coaches or business coaches. Um, and I absolutely love them. I think they are the most powerful. Like, let's say it's 2 days or a week. If you can just go and feel you are alive and coming home empowered, I want to be there to be that vessel for you. And I know so many amazing women who would work with me and, be the powerhouses in that retreat. Too. When your podcast airs in 7, 8 months, I'm so hoping I have my stuff together and I've started this process in this retreat.
I'm going to talk to you offline, but I think I want to air this sooner than what I originally told you because I'm doing a summit in January. I'm doing one now in October too, but the one I'm doing in January, and we'll get more detailed offline, but is going to have a legal component to it. So I'd love for you to be on the summit. But I also know someone who coaches women, what's the word? Women that have part businesses, so therapists and coaches. He coaches them on how to develop and create retreats. So I think you would be a really great fit for her too. So
Yes.
I start her coaching program in January. So I'm just really excited because I also want to have my own retreats. So I'll share that resource with you too, in case you're interested.
Yeah.
Look at us, we're gonna change the world one retreat at a time. Yeah, and so there's lots of people out there that have feelings about therapists and coaching. Um, I think it's usually the other way, though, that people worry about coaches overstepping into mental health and not having the credentials. And I can understand that point of view. I don't think you have to be a therapist to help people, but I think you got to be mindful and refer to therapists as needed. But I think for us mental health people, um, putting the label of coach, we don't need to do any more training. We already have all the tools to do the coaching already because of our credentials and our experience. However, having said that, our coaching certifications that you can still get if you want to, but we're not required to do that. And then you can take the pieces you feel you want to coach other women on all over until our licensing boards agree to grandfather us into all the states. Because I don't know about your licensing, but my licensing, I can be a therapist to women in Ireland, but I can't in California because I have a California license. Now, how bizarre is that?
Interesting. I've honestly never looked into other countries. I trained in England, uh, and it was so hard to get my California schools to count any of my English credentials.
Which is
And then I
ridiculous.
just stopped looking.
Yeah.
It was
Yeah.
very
And
difficult.
what kind of nonsense is it that we have to get licensed in every state if we're got a college degree and can get licensed in one state? All it is money making. My board, our licensing board, not licensing board, our National Association of Social Work licensing being grandfathered around the country because when people move, that way they can keep their therapist. And people that are in the military, every time they move, they have to get a new therapist. That's just really bad for continuity of care, right? So that's what I'm hoping will happen. So in the meantime, coaching makes sense for people. So
I agree. And during COVID, some states for psychologists, states changed and allowed out of state treatment, but California stayed pretty rigid, and we have some major limitations on what we can do.
yeah, and can you imagine you're knee deep a survivor, you're at this crucial point of therapy, and all of a sudden they get a job offer in a different state. Like, really? They got to start with somebody? That's not good care. That's really not good care. And I know
No,
there's rules where I know you can transition a little bit, like you can do a couple of sessions stuff. But otherwise it causes us to break licensing rules if we continue, right?
yes. And I work really hard to help them find a new therapist. I'll help vet new therapists so that they're not just going in and realizing, wait, this isn't going to work for me. But it's hard. Therapists never answer their phones.
We're in session is why. Yes, I know. Yeah.
I definitely try. I try really hard to soft handoff and then with the client's permission to update the new therapist so that they don't have to relive everything again and tell the story again. That's an ideal situation. It doesn't always happen. And
yeah, I also do the same thing, the warm handoff. It's preached pretty heavily in with clinical social work for sure. So I'm glad that we at least try to do that. So anyway, as we wrap up, because I do need to wrap up, are there any last nuggets of wisdom you want to pass on to survivors that might be listening anywhere in the world?
what sticks with me is to remind yourself that it doesn't have to feel this bad. And if it does and it's lingering, then you might that works for you. And it's time to start networking. It's time to start educating yourself and learn all the different ways that we target trauma and that we help people move past the strong emotions that come with the traumatic memories. Because the goal should be that you still may remember traumatic moments, but if we can detach the strength of the emotions, that is health. And it doesn't have to feel this bad. You just haven't found your spot yet that works. And people are so welcome to email me or reach out on my website if they want any advice or if I can ever help someone find a good fit.
Thank you so much for that. Your website is lesliedobson.com or Dr. Leslie.
Yeah,
Dr. LeslieDobson.com. Okay, awesome. All right, Dr. Dobson, thank you so much for being on our show today. It was really wonderful to have you.
Thanks for having me. And as a motorcycle goes by my office, have a wonderful weekend.
Yeah, thanks.
Thank you for listening in today. Please join us next week, same day and time. Also, I would love for you to check out my website, healthrivedream.com.